Hello all, this is Dr. Dheeraj Masapu. I am a consultant anesthesiologist and today I am going to tell you why I didn't choose surgery in 2008. So in my previous video comparing medicine versus anesthesia, I told that after finishing MBBS, some set of people will choose to enter medical branches like medicine, pediatrics, anesthesia, maybe radiology also, and some set of people will try to enter surgical branches like MS general surgery, orthopedics, and a list will go on. So in 2008, what thought process ran in my mind? There are 5 things which made me consider a medical branch, which I am going to tell you now, and maybe some might look silly and some will have some kind of meaning to it. Pus and blood and infected material, I didn't like it that point of time. So I didn't like the smell, and I didn't really want to get into the zones where 4 years gangrene cases where the kind of bad smell was coming from the wards. As a doctor, how can you talk like that? If you might ask me that question. But see, when I had an option in 2008 to sit in OPD and see patients and go into a medical branch, I thought maybe that is my calling, and if I didn't have an option, surely I would have done this. But since I had an option, maybe I would have thought, maybe let us try to avoid this and enter a medical field, maybe. So that is one of the reasons. Story I remember, the first time when I entered the operating room, I got a reading sensation and almost fell down. So this happens to many of the students when the first time when they see a body being cut. That happened to me. So maybe that also impacted me a little. That made me think that maybe this is not a field for you. So this is one aspect. So you can comment in the comment section about your views. So this is what I thought in 2008. So now what do I think? I'll tell you in the end of the video. So point number 2 would be the problem solving. So I actually liked to diagnose. I actually like to solve the puzzle, and if patient comes with some kind of a symptoms, okay, we'll solve all these things and we have to go to a diagnosis and treat him. So that kind of job description excited me more than cutting, opening, clamping the vessel and removing the tumor. Maybe those days I would have felt that little more mechanical, and I wanted to use my intellect and brain and thought of solving the puzzles. So for that, maybe I would have thought medicine is a better option. You can sit in the OPD, listen to patient complaints and then solve their problems. But now what do I think? It's quite different what I think now. I'll tell you in the end. So let me tell you the point number 3. So when I went to the surgical posting, so what I clearly observed is the surgical residents were treated in a very different way compared to other branches. They were being scolded and insulted, and they were made to stand for long durations, and then I really didn't like the work culture actually. At the same time, I saw anesthesia residents. They were actually sitting around, their senior is actually smiling and laughing with them. Maybe that is one of the reasons which attracted me towards anesthesia also, I don't know. So I didn't like the work culture in the surgical branches in those days. I don't know, now things have changed, and so that is one of the reasons. So I thought if I enter this branch, then maybe I also need to get insulted. I also need to work, like these residents and stand for long durations of time. I've seen some surgeons when I was in house surgeons who were operating for 16 hours, 18 hours and all. So I thought for standing for such long time is not my cup of tea. I thought let us go into some medical branches where you can sit and see the patients. This is what I thought in 2008. And 4th point is the work-life balance. So what I really thought is, I've seen surgeons in my house surgeoncy time coming in the morning and working in the medical college till evening, and then going to their private practice, seeing the OPD and operating cases in the night, and posting another case in the morning 5 o'clock and operating, and then coming to the medical college to teach us. And at the same time, parallelly, I saw the medical guys and anesthesia and pediatrics guys around. So they come in the morning, see the patients, go in the evening, maybe 1 or 2 hours they see an OPD and go home. So I felt that work-life balance is better in the medical field, and that made me, maybe would have made me take the decision of going into a medical side. So that is what I thought that time. And so the last point is, this is not against surgery, but I really loved the OPD practice. So even though I didn't practice that much in house surgery, but whenever I sat in the OPD, saw some patients and listened to their complaints, and then I'll take those complaints to my senior and tell him, he will tell these are the things and these are the tests we need to do, and then we can go to some 2-3 provisional diagnosis, and then we can come to a final diagnosis. So I like the process of OPD. So that actually fascinated me more towards entering into the medical branches. So these are the 5 reasons why I chose this one. But now most important part of the video, how many of these are relevant now, how many of these things I think foolish now, which I thought in 2008, I'm going to tell you one by one. So number 1 reason, what I told, pus, blood and infected material. See, the kind of smell I didn't like, I told, but after coming to anesthesia, you cannot avoid, because you have to give anesthesia to cases of Fournier's gangrene, you have to give anesthesia to gangrenous debridements and everything. So you finally end up staying in the OT with all the smell. So you cannot escape. So whatever, and blood and everything, which I didn't want to see, I see every day now, and blood losses I see. So the thing is, like, what I really wanted to escape, I couldn't escape. So the first reason is maybe I thought foolish those days. Second, problem solving. So what happened is, I thought medical branches are the only branches where you solve the problems and puzzles, but I'm very close with neurosurgical field now. I see them, how they actually diagnose the cases and how they treat and how they follow the post-op. There is a lot of problem solving in surgical fields as well. So this is what I didn't know. So even in surgical branches, actually they diagnose the cases and then they run more investigations actually than medical branches. And the investigations that surgical people run are very expensive, like MRIs, functional MRIs, and then PET-CT, SPECTs, and those things are even more advanced investigations, because before operating a patient, you should be doubly sure that you're operating on the correct organ, whether it needs to be removed or not. They'll have board meetings. It's more exciting, I feel now. So work culture. See, work culture, what I saw those days and now is little changed, I feel. So now even the surgeons are having a shift-based work, and there is a balance in their lives also. And this work-life balance concept, I don't believe now, because if you want to succeed in life, you have to work very hard, and to beat the competition, you have to be way ahead of others. For that, you need to put in the efforts. I always tell these kind of things in my videos, and then you need to work hard, you have to be committed, you have to be dedicated. That is how you differentiate yourself from others. So work culture is not a big thing, but at the same time, at least some time you have to give to your family, maybe at least 1 to 2 hours you go and spend with your family. But one thing which I don't like is some people go home and watch TV, Netflix and all those things. Maybe you can remove those chunk parts of your days, you can use that in your work, and you can, after coming back, you can have some quality time with your family. But if you think that the work is easy in medical field, then please don't enter. If you're MBBS guy watching this video, please note this point. If you think the work is easy, if you want a total relaxed life, then don't enter medical field. So that's about the work culture and work-life balance. OPD practice. So now I'm thinking how foolishly I thought, because surgeons also sit in the OPD, they see patients, and they see 2-3 days, they sit in the OPDs, and 2-3 days they operate. That is how the units run in medical colleges. Even corporate hospitals, 1 or 2 days the surgeons run the OPDs, and rest 4 to 5 days they stand and operate in the OTs. So there is a balance between OPD and surgeries. So most of the things which I thought in 2008 are wrong. That is what I came to a conclusion now. So now if you give me a time machine, maybe I'll choose a surgical branch, I think now. Because closely being with surgeons, I'm seeing how exciting the branch is. So why I didn't surgery, I told the reasons. And now what would I do if you give a time machine also, I told you. So this is for all the fans of medicine. Understand that it is not about medicine or surgery. Any branch is fine, because what you think now is totally different from what you're going to think 10 years down the line, 20 years down the line. So the reason why I did this video is for you guys to understand what you think now is not totally the right information. So the right information you will get only when you experience the field and the other fields, when you see other fields how they're doing. So many people think radiology is only about about sitting in the computer and seeing the image. It is not so. Radiology is intervention. Radiology people actually do biopsies, they put catheters and they embolize some areas. There are so many things radiologists do. So only when you enter the medical field, when you become a consultant, when you start dealing with people, then you'll understand the value of all the branches. Then you'll understand the value of pathology, microbiology, and how important the microbiology branch is. You only come to know when you become an intensivist, when you get a diagnosis, when you have to diagnose, when you have to start an antibiotic for an infection where BP is falling down. You need to choose the right antibiotics. There you have to discuss with microbiologists about the bacteria, about the sensitivity of the antibiotic, so that every branch's importance you will come to know only when you start working. So you cannot take decisions based on the experience and knowledge that you have now, because the knowledge that you have now is only 1 to 2%. 98% game is ahead. So you need to either follow people like me and watch the videos and take decisions, or you have to follow, you have to talk and discuss with other consultants. But unfortunately in India, what happens is most of the good consultants and good people who have experience, you will not have access to meet them, and you don't have time and they don't have time, and that never happens. So the only way is through social media. You have to get the information and then you have to take wise decisions. So thank you guys, that's it for today, and as usual, Dr. Dheeraj Masapu logging off. Roger that.